so much, Pallavi. Would like to start with the first panel of the day. It is on leapfrogging the diagnostic divide with AI. With that, I would want to say a good afternoon, good morning, good evening to all those who are joining us from different time zones. And I'm Divya. I work at Path, and it's been a privilege to be here and moderate this session. Today's session is being hosted by Path in collaboration with ICMR's National Institute of Research and Digital Health, Wadhwani AI Global, and Transform Health as an official pre-summit event under the India AI Impact Summit 2026. Before we start talking about the session, I would want to introduce my panelists with you. So we are joined here by our panelist, Mohammed Amil from WHO CRO. We have Dr. Lucia Rizka Analdusia. She's a Director General, Pharmaceutical Medical Device, Ministry of Health, Republic of Indonesia. We also have Mr. Monendra Suparna. He's the CTO of Dr. Lal Path Labs. And we are also joined by Dr. Vidushi Chaturvedi. She's the lead architect for Niti Aayog. I would give you a brief round of introduction for our panelists before we open the conversation. So Mohammed Amil is a technical officer at WHO's CRO region, focusing on health technology assessment, medical devices, and assistive technologies. He has extensive experience in evaluating biomedical equipment functionality, supporting rollout of extensive medical equipments, managing management models at district level, and providing technical guidance to member states on health technology adoption. He's been involved in the regional workshops on strengthening telemedicine and digital health tools across CRO. His work bridges gaps between technology potential, health system realities across diverse country contexts. We have a warm welcome for you, Amil. We are also being joined by Dr. Vidushi. She's the lead architect at Niti Aayog. She works at the India's apex policy think tank, the nodal agency, Niti Aayog, for catalyzing economic development. Her focus areas include AI and its multidimensional concerns, including inequalities, political culture, and social cohesion. She's also pursuing an LLM with specialization in cybersecurity law and AI regulations, bringing legal regulatory expertise to the AI policy development framework. Her work spans AI strategy, equity considerations, and the governance frameworks needed to ensure AI serves as public health good. We are also joined by Mr. Monendra Suparna. Monendra is the CTO for Dr. Lal Path Labs, and he serves as the Chief Digital and Information Officer as well. He joined the organization in 2007 and has over 22 years of experience directing business and technology operations in the healthcare pathology. His expertise includes leading large-scale business critical projects and successfully reducing turnaround times for customers, optimizing costs and managing risks associated with technology changes while improving service levels. He has a deep experience in laboratory transformation systems, healthcare IT integration, and digital transformation in diagnostic services. We'll also be joined by Dr. Lucia Rizka Analdusia. She's the Director General, Pharmaceutical and Medical Devices, the Ministry of Health, Republic of Indonesia. She's a clinical pharmacist who currently serves as the DG in the Indonesia's Ministry of Health. And she brings critical experience in epidemic preparedness and global health across technology access. Previously, she held leadership positions, including Director of Drug Registration and Directorate for Standardization of Drugs, Narcotics, Psychotropic Precursors, and Addictive Substances in Indonesia's FDA. She has been active in promoting local in vitro diagnostic manufacturing and strengthening pharmaceutical and medical device regulatory frameworks in Indonesia. So with that, I welcome you all. And now I would like to talk about the main agenda here. So what we are trying to do in this conversation is bringing out a working dialogue, which is not a one-way webinar. We want to talk about how access to diagnostic remains as one of the most challenging bottlenecks in achieving universal health coverage, especially in LMICs, where 2/3 of the global population even today lacks essential diagnostics. And this becomes a major gap in the sustainable development goals that we have versus the reality of today. And although AI has been positioned to leapfrog this, to bypass this gap for infrastructure, the need of specialists, and trying to bring the last mile, screening to the last mile, but the challenges do persist. So the affordability claims are often ignored versus the total cost of ownership. The regulatory capacities are in the LMIC especially are not really equipped to evaluate the tools with the rigorous rate of development that they are coming up, especially the AI diagnostic tools. And also there is not enough availability of trained validated technologies, and whatever are there, they also struggle to meet the realities of the weak infrastructure, the fragmented supply chains, and inconsistent power, and other population issues that we face. So this session is going to ask some uncomfortable questions. We would want to understand what the health system readiness actually means when primary healthcare centers lack electricity. What does affordability mean when procurement, maintenance, and training costs are rarely uh, disclosed or understood completely? What does scale mean when regulatory systems can't keep pace with technology deployment? So, with that, I would want to start with the first round of questions. And my first question is to you, Amil. Well, you work on the health technologies across the CRO member states with such diverse system capabilities. In your opinion, across South Asia, the diagnostic access gaps are often driven by uneven infrastructure, workforce shortages, supply chain instabilities. So, from your experience, how AI-enabled diagnostics can move beyond pilots, function as reliably in routine care, and operationalize the NEDLs for the countries? And what does readiness actually require beyond just having these equipments?
Sure. Thanks, Divya. Reality is most countries are still at early stages, and some are developing, say, their national essential diagnostics list, other are piloting digital tools, and many are working to strengthen their basic infrastructure. Now, moving beyond pilot will require a shift from technology demonstration to system integration. And AI must be embedded in routine workflows, not just as a standalone tool, but as part of the broader diagnostic ecosystem. And readiness is not just about equipment, as you rightly mentioned. It's about having robust digital infrastructure, trained personnel, interoperable health information systems, and clear regulatory frameworks. And we need to ensure that data privacy, algorithm transparency, and ongoing technical support is there with the countries. For operationalizing National Essential Diagnostics List, as you know, we've been the forerunners in developing NEDLs globally. Most of the countries that have NEDLs are within our region, and we also have taken up the lead in operationalizing them as well. And now we are starting to work with Path and other partners to develop this guidance document on how to operationalize National Essential Diagnostics List with digital tools on training, on governance, and the monitoring and quality and everything around it for seamless operationalization of an EDL there. And AI can help automate all this from test selections to reporting to quality assurance, but only if it is tailored to local context and linked with national health priorities that we are trying to do. So there's a lot of promise going forward, and we invite more people to come and partner with us and work with us. And ultimately, my last point here is why I say this is because success will depend on our partnerships now with ministries of health, with technology providers, with frontline health workers, and we must invest in capacity building and ensure that AI solutions are accessible, affordable, and sustainable. And we need to work together on this. Thank you.
Thank you, Amil. When you mentioned that there is an important role that the governments and the other players play, with that, I would want to bring in Dr. Lucia Risca Anandus Lucia. Ma'am, you regulate pharmaceuticals and medical device industry in Indonesia within the national health systems. So my question to you is, when AI-enabled diagnostic tools are introduced, how do the regulatory systems assess their suitability for broad deployment across the region with varying infrastructures and capacity? And how do you ensure they'll work across Indonesia's vastly different settings? Dr. Lucia? Okay, so maybe I can take it. She's coming back in some minutes. Maybe then I'll take this question to Munendra. Munendra, so seeing the background that you have of technology integration within a large diagnostics network, as also Amil mentioned that there is an importance of system integration that is essential to ensure that these technologies actually play the right role that they're designed for. So from an operational perspective, when AI tools are integrated into a diagnostic framework, what are the practical conditions that must exist for these systems to improve the efficiency and quality? And based on your experience, where is AI adding the genuine value in diagnostic operations versus, it's still more a promise than a practical impact?
Yeah, thanks a lot, Divya, and good afternoon, everyone. This is Munendra, and I'm representing Dr. Lal Path Lab. It's a commercial organization. India is one of the largest chain of diagnostics. As far as Divya, as far as this particular questions of yours, as per Mr. Amil's representation specific to the challenges and all, referring to Dr. Lal Path Lab, I think from the selection of AI or maybe some kind of optimization of AI, there is good amount of options available outside market. There are two lens where we are selecting as a AI tool or AI platform in Dr. Lal Path Lab. Availability is more than enough, first of all. Secondly, there is a good time to have a right selection. So there will be a chance we may end up wrong decisions as far as the selection of tools are concerned. But though we have started AI journey way back, maybe 3, 4 years back with the consolidation of data structures and all, because we know the power of data, because it's a very old organization in India and would have a good amount of multi-millions of record with the longitudinal data sets all. We know which use case and which technology and pipelines is more suitable to enhance the productivity to my processes, to enhance the productivity of my internal executives, so-called doctors and clinicians. That is the one of the challenge which we are very much cautious about and very much on that particular trajectory of selecting the tools. Secondly, from the data sets perspective, unless until we have a good quality data sets, it could be something structured and unstructured, because we may require some structured data set along with unstructured data set with a longitudinal lens also to enhance the some kind of AI tool accuracy and you can say unless until we have an accuracy level, we can't give that particular tool to the production environment. That is the another area where we are very much cautious to have some kind of selection. Secondly, availability of skills would be another challenge as far as Lal Path Labs are concerned. Why I'm claiming that thing? Because all good resources are good to join all technical companies, tech world. But in Lal Path Lab, we may have a good data scientist, but the availability of skill sets along with some kind of trainings to my existing ecosystem, that would be another area where we have to see some kind of challenges on ground perspective. But nevertheless, we have a good amount of pipelines, which is in WIP, good amount of pipeline, which is on the matured and accuracy level. We have an association with the big tech institutions of India, like IITs of the world. We have a pipelines and we have a structured roadmap and tracks to mitigate the expectations of our. Coming back to the data sets perspective, because we have a good data set, we know the power of data, and we are very much on that particular trajectory to suffice the requirement of my employees and our customers, so-called, to enhance their turnaround time and experience specific to AI. Thank you.
Thank you so much. That's very optimistic, and that sounds very hopeful in the case where what we are trying to discuss, how AI is leapfrogging. With that, I would circle back to Dr. Lucia. So, ma'am, you regulate the pharmaceuticals. I'm sorry, I'm repeating my question. Pharmaceuticals and medical devices within Indonesia's national health systems. So, when AI-enabled diagnostic tools are introduced, how do the regulatory systems assess their suitability for broad deployment, especially across a varied infrastructure for a country like Indonesia? How do you ensure that they work across all settings?
Okay, thank you. Good afternoon, because in Indonesia, it's the afternoon. I don't know where you are now. Yeah, I'm sorry. I'm late to join this discussion. Yes. We apply a risk-based and phased approach. Yeah, before broad deployment of the AI product. Developers are encouraged to conduct local validation and real-world performance testing in representative facilities such as in as a urban hospital, district health center, and resources limited setting to ensure consistent performance across the population and environment. We also assess workforce readiness, usability for frontline hard workers, data governance, and cybersecurity. Through post-market surveillance and continuous monitoring, we track real-world performance and address emerging risks. And our goal is not only to approve innovation, but to ensure AI tools are equitable, scalable, and sustainable across Indonesia's diverse health system.
Thank you so much, ma'am. The way you explained that you're not just only deploying, but you're also assessing the various parameters that make it critical for the AI tools to be supporting the health systems in Indonesia. With that, I would want to connect with Dr. Vidushi and take it on, where she is in the role of examining AI's broader implications, including the inequalities, the systemic impact that AI technologies can have. So, ma'am, AI diagnostics are often presented as a way to expand access. But from a systems perspective, what risks should policymakers such as yourself consider to ensure that these tools do not reinforce the existing inequalities in countries? And what regulatory considerations around the data security and algorithm transparencies are being prioritized? Dr. Vidushi, please.
Sorry, still muted. Yeah, yeah. Hello.
For that, and by longer. 25 years, so there has a system and what
There is an audio problem there.
Yeah.
Yeah.
Dr. Vidushi,
Hello? Yes, I can hear you. Okay. You can hear me?
Yes, we can. Dr. Rizka, this question is for Dr. Vidushi. We're just trying to connect to her to understand her perspective.
Okay.
Dr. Vidushi, can you come again? I think we have a network issue.
Okay. Sorry. Can you repeat again the question, Divya?
Yes, ma'am. I will repeat the question for you. This is for Dr.
Sorry.
Vidushi. This question is for Dr. Vidushi.
Oh, okay. Yes.
Yeah.
Please.
Dr. Vidushi, can you hear us? Maybe then we'll move on to the second round of conversation. With that, in the second aspect, we are now going to discuss how partnerships and affordability can be integrated for a pathway to scale. And in this regard, my first question will go back again to Dr. Rizka. So, ma'am, in your experience, where drugs and medical device regulations span expansively, how local manufacturing, promotion, and epidemic preparedness through CEPI, where technology access and sharing are critical, how does this become important in case of Indonesia's adoption approaches in the AI diagnostics? And how are these issues like encouraging local production and making diagnostics more accessible and affordable for Indonesia or similar LMICs become important?
Okay. Yeah, thank you. we learn from the pandemic situation, and so we want to make the resilience in the pharmaceutical and medical devices sector. We focus on balancing innovation with public health needs by ensuring solutions are clinically reliable, interoperable with national system, and deployable even in resources limited setting. And on issues like encouraging local production, encouraging local production is a key strategy to make AI diagnostic more accessible and appropriate for Indonesia and other low middle income countries. The main challenges is not only technological sophistication, but whether AI tools are affordable, context sensitive, and aligned with local healthcare needs. By promoting collaboration between local startups, healthcare provider, universities, and domestic medical device industry, AI diagnostic can be developed using locally representative data while adhering to strong ethical and data protection standards. Supportive regulatory framework, targeted incentives, and public investment in research can further accelerate innovation without compromising patient safety. When integrated into a primary healthcare system, including services in rural and underserved areas, locally developed AI diagnostic can help expand equitable access to equity healthcare and ensure sustainable long-term impact.
Thank you so much, ma'am. That's very helpful in understanding the key strategies that Indonesia adopts basically to improve the local manufacturing and how local integration of such innovations can happen. With that, I'll move on to my second question for Mohammed Amil. So, Amil, AI diagnostic deployments require a lot of coordination between governments, technology providers, healthcare facilities, and technical agencies like WHO. So, from your work that has been supporting member states in CRO, what collaborative mechanisms are working to facilitate the health technology integration? And where do you see these opportunities for regional collaboration or South-South partnerships that can help these countries adopt and do a sustainable AI diagnostics network more effectively? Amil, over to you.
Yeah, sure. Thank you so much, Divya. Uh, Collaboration is definitely the cornerstone of progress in diagnostics. So many stakeholders have to come together. In CRO, we are seeing strong partnership between the governments, the WHO, technical agencies, the private sector innovators. So regional platforms such as joint workshops, the knowledge exchanges, and pooled procurement are helping countries share best practices and accelerate the adoption of digital tools. And South-South partnerships are especially powerful because countries in our region are co-developing guidance document or an EDL development, sharing lessons from pilot project and building capacities together. And this approach ensures solutions are locally relevant and scalable. So we also see opportunities for harmonizing regulatory frameworks and developing shared digital infrastructure and creating regional training programs for AI-enabled diagnostics. So in CRO and beyond CRO, we're also supporting countries, some in the Western Pacific region. For example, Brunei Darussalam and Philippines, going forward, Mongolia and others as well. And by working together, we avoid duplication, reduce costs, and ensure that innovations reach the communities that need them the most. Yeah, thank you.
Thank you. I mean, that really brings out the importance of how collaboration is helping the LMICs and how the important role that organizations are playing. With that, I would also want to take the lens of a public provider like Path Lab. And Munendra, this question is for you. Where from your experience, how managing an IT investment or a cost operationalization at your organization shows the real picture, that for AI-enabled diagnostics that include implementation, maintenance, training, and ongoing support. And what financing or business model approaches could make these tools really viable in a resource constrained setting or in a public health sector?
Yeah, being in the commercial organization, it's a budget-driven organization, and If that is the scenario, then we have to have some kind of actual use case, because we are not going to the adoption of new tech which is available in the market. We are chasing the use case first, and if that particular approach is there, I think we will take a right decision at the right time with the right spread. So that's the very high level vision and global statement, or maybe a approach which we are following nowadays, or maybe at the start of the any of the new strategic initiatives or investment. As far as the infrastructure, no doubt there is a need for good amount of lands to be taken care at each stage of the strategic initiatives of AI adoption in Lal Path Lab. But because the investment is very strategic in nature, and unless until we have a use case where we can do some kind of optimization in terms of experience and productivity, we will be in trouble in future. Considering all these kind of initiatives, we started with data consolidation adoption after COVID to 2022 with some kind of health cloud as one of the thing, and consolidate all kind of data structures in place. And now we have a very specific use case specific to department. It could be some kind of, or maybe specific to organ and disease. It could be cancer detection. It could be NIPT or genetics in the pipeline are concerned, and very much focus on the strategic approach perspective.
Thank you very much.
Thank you.
With this conversation, it really highlights the importance of how collaboration, both from country governments, organizations that are supporting regionally, versus the private sector, that they play an important role in bringing out the importance of how AI can actually leapfrog the gap that we see in the health systems, and the access to health can really be reached till the last mile. With that, I would also want to give you last 1 minute of consolidating your thoughts and give a last question to all three of my speakers. The question is common, but yes, I would take feedback from three of you one by one. So the question is, if the Global South is going to close the diagnostics divide with AI on its own terms and not waiting for the solutions to be designed elsewhere and then being brought to the Global South, what is the one concrete thing that we need to build together? Is it a regulatory framework, a financing model, a partnership structure, a capacity building mechanism? What would actually move the needle? And maybe we can start from Dr. Lucia first. Ma'am.
Okay, thank you. A practical priority for the Global South is to build a shared regulatory and validation ecosystem for AI diagnostic, with a common principle for AI as a medical devices evaluation, joint assessment, and also share real-world validation that reflect diverse population and health system context. This will reduce duplication, lower development costs, and accelerate responsible adoption while maintaining safety and effectiveness. With coordinated capacity building and sustainable financing enables countries to shape AI diagnostics that are locally relevant, equitable, and scalable access the Global South.
Thank you, ma'am. Dr. Mr. Munendra, if you could go next, please.
Yeah, if I'm wearing a hat of techies or a business leader, I will take this particular question in different form and shape. It's not a matter of Global South, it's a matter of data accumulation. Because if any use case or pipeline is specific to geography, then we can't achieve the accuracy level. It's not a matter of India or Global South. We have to have some kind of Global South or global in such a way that, let's assume there is a pipeline which will be easily adopted by the Global South or maybe India or China or any part of the world. That could be a good for the community as a one thought. But coming back to Global South, it's a good reach or good baby steps that we have to extend our services back to Global South or vice versa. There will be a good amount of technical know-how which is to be taken care of. We have to have some kind of handshake with the data sets, because we have a data of Indian, they have a data of their region, geographical region. We have a good amount of infrastructure which can be easily shared to each other, so that we have a one common mission to achieve for one of the challenge which will be fruitful for the community and the citizens of each and every individuals. Thank you.
Amil. Over to you, please.
Sorry, Divya, your voice was feeble. You're asking me to summarize, right?
Yeah. The last question I just asked: what should we build together if we have to build one concrete thing in this current landscape?
I would build together. I would definitely develop a guiding tool, a digital tool that will help countries in um, actually operationalizing, and it could be more of a guidance on how to use AI and operationalize so that the essential diagnostics list that countries are developing, they are implemented well uniformly across the countries. That could help them to look at the whole value chain life cycle of the diagnostics, starting from you see the procurement until how the diagnostics results are delivered in a more quality assured manner. Thank you.
Thank you. Yes, with this constructive feedback of what should be done, where it should be rightly placed, how the systems should interact with each other, and how AI can actually make a difference if it is tried and tested and deployed and piloted within the health systems, really brings out the real essence for the communities that it intends to serve and bridge the gap. We actually would want to wrap up this conversation by starting where we ask this question, where AI can genuinely. I think we have Dr. Vidushi. Dr. Vidushi, are you here with us?
Can you hear me?
Yeah, I can hear you.
I'm very sorry. I don't know what happened. I just don't know. I don't have a clue.
Okay.
So, yeah.
Yeah, we are still in the session, and maybe if I can circle back to asking my questions to you.
So, yes, so I was saying that, as a civil servant and as a part of the health ministry, we often mulled over this question of, where the start has to be made and what is most important. So, like as Neeraj ji was saying, scalability is important, but for us, inclusion and equity is the most important aspect, especially when you know that India is such a diverse country. And we have people like, if you talk about scalability alone, then there are many people who are extremely well off and they are not actually so much in need, whereas there are tribal areas, there are communities which are absolutely not marginalized. And for them, bringing them back into the fold is the most important aspect. So, well, yes, capacity building is where I have to begin, and educating the masses and letting everybody know of how to go about a technology, because technology is a double-edged sword. It can have benefits, it can have harms, which, may outweigh the benefits. Therefore, I must be AI ready in terms of letting my people know of what they are going to enter. And as policymakers, we have to be on our toes to understand the technology, because this is an untested technology, let me tell you. And as CDSCO has been, aiming at reforms and relicensing and suggesting the kind of licenses that are required for software as a medical device, these things are absolutely new. They were not there earlier. So everybody has to learn, and we have to keep learning and evolving as we speak. And that's a tall order. That's a very huge challenge for us. So yes, capacity building is where we begin if I were to take the cue from what you are asking. Thank you.
Thank you so much. With that, I would also want to ask my second question, if you would want to continue. Given your focus on the AI's impact with inequalities and the work that you do in AI regulations, what mechanisms does India have, and how we ensure that these tools ensure the public health goals, protect the patient data, they maintain the algorithms accountability, and we're not inadvertently widening the gaps for the gaps for the people who get the benefit versus who are left behind?
Thank you, Divya, for that question. That's a very, very relevant question, very significant. And AI is evolving at a very rapid pace, and AI is transnational. It is not something that's happening in one part of the world, and the other parts of the world are absolutely untouched by technology. AI is omnipotent and omniscient. It's everywhere. Having said that, how AI is going to translate into benefits for me and for my people may not be the same as how AI is performing and delivering in another geography, in a developed country. And rightfully, you are asking about global south. And the time we were in kindergarten, we were talking about global north and global south, this divide. And we see that this divide might be widened by AI. So instead of AI, addressing the inequity and inequality debates, it might get to widen these disparities that are existing in our world today. So, as a regulator, as a part of the government, my focus would always be to tame the technology, to see to it that technology does not become unwieldy. And I was in the PCPNDT Act implementation team. And the handheld devices were a big challenge for us because we were licensing the machines that were stable and that were installed in a place. Whereas the handheld devices could, move from one place to the other within no time, and we did not know how to handle those, how to license it, how to implement and monitor the machines. That was a big challenge. And how are we going to ensure that AI does not add to these disparities is something that we are learning, learning by and by. And it's like post-market surveillance. So for instance, even when a device has been launched and it's being used, we have to keep on monitoring. The grievance redressal mechanism has to be very strong. And the pre-test and the, now pre-testing is as important as the post-market surveillance. So, I mean, you have to keep into your consideration each and every aspect of the entire spectrum of governance. And yes, the governance mechanisms also have to evolve. So, for instance, earlier we had in India we have sectoral approaches. So each sector has to regulate its own machinery. For instance, TRAI, Telecom Regulatory Authority of India, or CDSCO, or you have your ICMR for research. So all these agencies are, and also consumer redressal forums, they have to each of them make their own regulatory mechanisms. And let me also share with you and the panelists that in a recent court case, the court has said that if a regulatory body creates guidelines, then they have the force of law. Whereas we all feel that, guidelines are only principles to be, they only steer us. They are not mandatory. There is no penal provision attached. So, one has to be very mindful of the regulatory principles that are being laid down by the sectors. So, while India does not have a comprehensive all umbrella like, the EU AI Act, but of course, we have the DPDP Act, and we also have each and every sector is alive to what is happening, and they are regulating by and by, every day they are alive and they are amending and they are putting policies into the public domain and eliciting public opinion and modifying the principles as in, when it's required. Thank you.
Thank you so much. That's really valuable thought, and that actually brings out the real way in which this is the directionality that we need to take for AI to really pick up speed in terms of the innovations that are coming in the ecosystem. Thank you so much. We'll also take up some Q&A, and we have some questions from our audience. Maybe I can read the questions and would request the panelists to answer. So the first question is, what measures are important to ensure transparency in algorithms and data privacy as we look at introducing AI-enabled diagnostics in our national health systems? Maybe Dr. Vidushi, if you want to take that.
Well, so the Data Protection Act that we have recently notified, and the rules they impose a very heavy fine if there is a violation of the provisions. And if the data principles without the data principles authority and consent, we are sharing data or we are using it for purposes which were not disclosed earlier. So there's a whole list of do's and don'ts that has been outlined. And the companies and the innovators have to really be mindful of what all has been, within what parameters they are supposed to perform. But having said that, India is also giving a huge incentive and push to innovation. So the innovators need not be, wary of uh, uh, innovating and trying to find newer solutions to existing problems, because at the end of the day, it is the human problem that we all are trying to resolve. And that is at the center, the human being is at the center. And therefore, human in the loop and human on the loop becomes very important. So the supervision has to be in the hands of the individual, of the person who's monitoring. And going from there, the whatever tools we are making, whatever algorithms we are making, we have to ensure that the testing has been done in a very fair manner. And that is another reason why we are also having the test beds, as we all know. And it's not something that can be done in a point in time. It's something which has to go on and on. So it's like it's an ongoing mechanism. And again, I would say the sectoral approach works best for India, because we are such a plural and such a diverse country. And well, and again, this is something which is not frozen in time. We are learning, and we are in the phase of narrow AI. So it's just the beginning. We don't know how it's going to roll out. So we have to keep our eyes and ears open and learn on the way. That's what I would like to say. Thank you.
Yeah, very thoughtful. Yeah, thank you, ma'am. So there's another question. Maybe I'll request Amil to take that one. So Amil, the question says, for countries without mature medical device regulators, is it more pragmatic to regionalize the AI validation capacity rather than build the national health systems from scratch? And I would want you to take this with the lens of the collaborations that we can build across countries and share the informations and the knowledge that we already have.
Thank you, Divya. So normally in such cases, what we do is because you see the medical devices is comparatively newer subject compared to medicines, and so is its regulations. And most of the LMICs are not geared up yet for stronger medical devices regulations yet, and regulating AI is much advanced. So what countries normally do is they do a reliance mechanism wherein, so for example, in WHO CRO, we have a mechanism called Southeast Asia Regulatory Network, and Indonesia was the chair until last year of the working group 5 that I used to be a part of for the medical devices, and countries would do so it's a minimal regulatory mechanism wherein you choose the set of regulators. It could be, say, for example, the East Asian countries could look at the Australia, or depending on your the market where you are looking at, and then you work on it rather than expecting from day one that you will have all the regulations in place. And in parallel, you can, of course, go on and build upon it. So that's how the regulatory mechanism helps on a reliance mechanism. So we also have a global benchmarking tool plus for medical devices. Which countries are assessing themselves and building upon it, and that these kind of benchmarking tools also helps them in local production, because until unless you have some basic regulations in place, local production also doesn't sell really well. So you need to have that first and then go on to local production. Thank you.
Yeah, that's very helpful. Yeah, with that, and when you mentioned Indonesia being the institution where the country where they were managing the reliance, I would want Dr. Lucia to take the next question. So the next question, Dr. Lucia says, how can LMIC governments avoid becoming passive test grounds for AI tools developed elsewhere, while still attracting innovation and investment? Dr. Lucia? Okay, so Dr. Vidushi, would you like to take this one? Dr. Monendra, can you hear me?
Yeah.
Yeah, so maybe I can repeat my question. So it says that how can country governments, maybe I can generalize that to say,
Yeah.
how can LMICs avoid becoming passive testing grounds for AI tool developed elsewhere while we still attract innovation and investment?
See, as far as these kind of approach, I think we should be okay to adopt new technology which could be originated from other geographical locations, because this particular era is a very innovative era. If we are restraining or we are controlling ourselves in such a way that our tool and our approach would be a regional in nature or maybe country specific, then we have a longish period to accommodate new technology, and we may have some kind of challenges in future, because it's a race, and we have to have some kind of adoption of new technology unless until we have a desire or we have a use case. Considering these kind of approach, I think we should be open to adopt new technology originated from anywhere, but I think that should be the right approach for considering current affairs. Rest, because we have to follow the rule of land as far as the data are concerned, and we are very much focused on that particular guidelines and guardrails and the guiding principles of Government of India. That could be another lens which we have to think, but from the adoption of new technology, it should be open one.
Thank you so much. While we have a lot of questions, I think in the interest of time, we would request our panelists to probably answer them in the chat bot itself. And with that, I would want to just close the session by talking about the fact that yes, AI can genuinely close the diagnostics divide. And we see a lot of hope with the way our panelists have mentioned about how the lens of the government coming, the lens of the CRO, WHO region, and private players and the policy makers, making us understand that it's not just something of the future. It's going to come in here with its guardrails in place and the collaboration, the effort that is happening, the South-South playing a major role, the regulatory harmonization, and the lot of ownership in the countries and the governments to take up AI technologies to actually build this gap. And this is happening in the future. So with that, AI diagnostics is not a shortcut around the health system strengthening. I think it's only working to build on the top of the basic fundamentals. And we would want to have a big thank you for our participants of the panel, Mohammed Amil from WHO CRO, Dr. Lucia Rizka from Indonesia's Ministry of Health, Mr. Monendra Suparna, and Dr. Vidushi from NITI Aayog. Thank you so much. And with this, we'll close this session, but the next session will explore the data governance frameworks that make trustworthy AI possible. Please stay with us.